All right, next up we have a thought process which I'm going to call indirect presentation. Unfortunately, in psychiatry, the phrase that uh, is usually used is like when someone is speaking in like riddles, or in a very convoluted or seemingly difficult way to understand. We also call it punning or riddling. I don't really like that phrase because it makes light of a situation where levity really has no place. But the essential concept of what's trying to go on here, and it's again the prototypical example is usually elder abuse or child abuse. The question writers will try to give you a lot of information, and you have to tease out one particular or two particular points that clue you into elder abuse or child abuse. And again, there's a lot of information that may seem irrelevant, but it's really, really important actually, because most of these patients are more vulnerable, and if they're being abused, they're less likely to be able or feel comfortable enough to just come out and say directly what it is going on. So there's a lot of reading between the lines that has to happen in this thought process. There's a lot of um, uh, careful reading and understanding of exactly what the patient may be experiencing, and a lot of empathy that goes into these questions. So these are actually some of the more well constructed and well thought out questions, and it's really interesting and it's really amazing because it helps us during the exams and also in real life to understand, like, okay, what are the red flags and what are the signs that I need to look out for in order to tease out that someone may be being abused in whatever way, because these really are tend to be indirect presentations. So someone doesn't really have like a linear constellation of symptoms that is, okay, XYZ, I need to work this person up for abuse, or I need to call these types of services. So we need to be able to understand this thought process and these types of questions so that we can understand them in real life and help real patients.